Hi, I'm Amanda Carmine. I'm a licensed counselor, mental health in Delaware, and I wanted to provide a free resource for the healthcare workers out there right now that are dealing with COVID-19, dealing with patients and their families. I'm sure it's a lot of stress and duress, and a lot of places are not equipped. So I'm hoping to help from a mental health standpoint, to help the helper, basically, help the healer. So, what I'm going to do is I'm going to identify compassion fatigue and then what to do about it. The reason why I wanted to offer this is because I do have friends and family that are healthcare workers, nurses, doctors that provide direct patient care. And I felt that it was necessary to talk about something that quite isn't addressed in trainings that you have you probably haven't heard of. So, what is compassion fatigue? Compassion fatigue is the physical and mental exhaustion and emotional withdrawal from experienced by those who are caring for sick or traumatized people over an extended period of time. A lot of times, what this is identified as is vicarious traumatization, secondary traumatic stress, or also somatic countertransference. So, a lot of times in counseling, we talk about transference, which is what our patients or clients experience in response to counseling or in response to the healing setting. And then there's countertransference, which is what the healer or the counselor experiences in reaction to that. So, the somatic could be the psychological effects that one is experiencing. So I'm going to go over some psychological effects and also some physical effects too to help you identify what you may experience or that you may see in others. So the psychological effects are frequently unnoticed, and it's disassociation. So this is feeling out of connection with oneself physically, emotionally, maybe feeling numb, like you're just kind of coasting along. It could also just kind of feel that numbness physically as well. It can be depression, anger, anxiety, sleep disturbances, nightmares, or feeling of hopelessness or powerlessness. I'm sure a lot are experiencing limited resources and there's limited protocol just because of what's going on. So I'm hoping to address the mental health end of things so that way we can be more equipped and help with that feeling of powerlessness and hopelessness at this time. So some things that you can experience physically would be nausea, headaches, changes in body temperature, general constriction, dizziness, fainting spells, impaired hearing changes. These are all indicators. These physical and these emotional responses are all indicators that your body is giving to you to let you know that you're in risk of burnout. Now, the reason why burnout is so important, and this is something I heard about in school while I was in school, is because as healers, as helpers, we have a high risk of suicide. If we're not doing that self-care, if we're not paying attention to the signals, if we're just going about and just patient after patient after patient and not really connecting, then we're at risk of burning out. And this can have other effects as well. This can impact the relationships in our lives. This can lead to unhealthy coping mechanisms such as addictions. So we want to make sure that we're doing the best that we can. It's quality over quantity. And I know that's probably something that seems pretty foreign in a time like now. But if you equip yourself the best that you can, you're going to likely be able to offer the best quality of care, that's what we want to do, right? We want to provide that best quality of care to our patients as much as you can. A lot of times we get so focused on the numbers that we overlook the value in ourselves and the value in the connection that we offer our patients. But this is going to be the point where we feel empowered and we feel less hopeless and knowing that you did the best that you could. So that kind of ties into what to do about compassion fatigue if you're experiencing it. So first and foremost, it's putting yourself first. So that's important to that quality of care. We think that about others, but if we're not doing it and embodying it ourselves, we're going to not be able to be at the top of our game. So it's making sure that your basic needs are met. And I'm sure before all of this, there's a lot of healthcare workers that barely had time to take a break. But this is the time where you really need to just do that hourly inventory and just say, like, where am I at? What is it that I need in terms of your basic needs? Food. Do you need some water? When's the last time you drank something? It's taking that 5 or 10 seconds or a minute or 5 minutes, 10 minutes, whatever it is that you feel like you don't have, to really just have your basic needs met. If your basic needs aren't met, then you're going to be unable to provide quality critical thinking and be able to use those skills that you need to use to help people in a time of crisis. So take that second to grab some water, to grab a cup of coffee, to grab something to eat, to just take a breath. Okay, so that's the point where you would pause and just take a moment, take that inventory, and address those basic needs. What also can be helpful is having a daily routine. So something before maybe your shift where you exercise, meditate. Maybe this is a good time for yoga, or you can do some daily intention or affirmation. This is a point where tying in your purpose. Why did you become a healthcare worker? What led you, or why were you drawn to help others? It's easy to lose sight of that when you're going about taking care of others in a time of crisis. But just bring yourself back to that. So if it's something you can do before your shift, as well as maybe after, to help reinforce why you're there and what you're doing, and knowing that you're doing the best, that would be helpful. If there's some kind of memento or something you can do, as a screensaver, or something you can wear to kind of remind you when you take that moment and you take that inventory and you just stop and just take some deep breaths, that's going to bring you back to that purpose, and a lot of times what we do is we focus a lot on the negative, and this would bring it back to more positive. If you focus more of your energy on the positive and the positivity, which can be hard when you feel so outweighed by the negativity of what's going on, but that's going to go back to that quality care that you can offer. This is a good time for relaxation techniques or deep breathing. So there's a 4-7-8 method. The 4-7-8 method is where you breathe in for 4 seconds. And then you breathe out for 7. You breathe in for 4, you hold for 7, and then you breathe out for 8. So it's breathe in for 4, hold for 7 seconds, and then breathe out for 8. Okay, so that's a good technique, the 4-7-8 method. You can also connect with others. A sense of humor can go a long way. Connect with others. If there's like something you could share, some kind of humor, remove yourself from the situation for a couple seconds, collect yourself, connect with some loved ones. That feeling of support is really helpful. And it gives you a sense of self-confidence and having that gratitude. So you want to try to bring yourself back to things that are helpful and positive for you, because you deserve to feel replenished, and you deserve to feel re-energized as well. So hopefully some of these tools and techniques will be helpful at this time. Feel free to contact me if you'd like some resources, you have some questions. I have an Instagram and Facebook page. I have Instagram and Facebook pages at Delaware Counseling. I'm hoping this is helpful for some of you. And if you're a supervisor, this is a great time to check in with your supervisees as much as you can. And if you have a supervisor yourself, this is a time to be proactive in stating what you need. And it's okay to ask for what you need. It's okay to state what you need. And this is a time where, communication is really helpful. So I would try to communicate as much as you can, connect as much as you can within yourself and with others with what you have to work with, and know that you're doing your best. And I just want to say from the bottom of my heart, I thank you so much for what you're doing and being out there on the front lines and really helping people and doing the best that you can. So thank you, and try to do that self-care as much as you can daily. Thanks.